durable left ventricular assist device, or dLVAD, is implanted in patients with advanced systolic heart failure refractory to medical treatment with variable outcomes. In this study, the authors developed a model for predicting 90-day mortality in patients with dLVAD using the largest database of real-world dLVAD implants, STS Intermacs. The study included patients receiving a primary implant of a fully magnetically levitated continuous flow dLVAD at 176 centers participating in STS Intermacs between January 1, 2019 and September 30, 2023. The study cohort included 11,342 patients, divided into a derivation cohort and a validation cohort based on the implantation date. Overall, 90-day mortality was 8.0% in the study population. A multivariate logistic regression model was developed based on preimplantation risk factors using the derivation cohort. The model in the derivation cohort showed an area under the curve, or AUC, of 0.714 and Brier score of 0.08. In the validation cohort, the model produced similar results, with an AUC of 0.707 and Brier score of 0.08. In the entire cohort, the model showed AUC of 0.704 and Brier score of 0.07. In all cohorts, predicted risk was overestimated among patients with a predicted risk of greater than 0.4. The hospital-level variation analysis identified 22 centers with higher and 14 centers with lower than expected mortality. The study provides robust benchmarking rates for 90-day mortality and may serve as the foundation for quality improvement initiatives for dLVAD therapy.